just wondering, like, because I can't see if it's pointing at your face.
Oh, so yeah, you could turn it around.
Oh,
yeah. Or like yeah, redo the photo.
Share versus students high tech. More high tech than art.
Art like 1991 leadership.
At least we can switch. Flip over.
Ask reserves touchscreen Nicholas.
Right?
Are you guys ready? You're ready.
Good afternoon. Welcome to this public hearing on the medical referral program being hosted by the House Standing Committee on Health and Welfare. My name is Tina Sablan. I'm the chair of this committee, and I now call this meeting to order. Today is Thursday, May 6, 2021. It is 3:30 p.m. in the Antonio C. Attelig Library Conference Hall here on Rhoda. I'd like to thank Mayor Attelig and the people of Rhoda for their assistance and hospitality in providing this venue and accommodating this public hearing today. For the record, present today from the committee are members Vice Chair, Representative David Staffler, and Representatives Donald Maglonia, Sheila Babata, and BJ Asa. We now have a quorum with all 5 members present. Staffing our committee today, I'd like to recognize our House Counsel, Joe Tyron, our Legislative Assistants, Ms. Claire Sablan, Mr. Fano Taitano, Mr. Cameron Nicholas, our Sergeant-at-Arms, Pete Tawai, and Dr. Lahi. Staffing the committee as well is our Legislative Aide, Ms. Nava Kaur. This public hearing is being live streamed on Facebook. Thank you, Nava, for making that happen. All right. So with all members present, we can now begin. May I have a motion to adopt our agenda for today? Motion has been made and seconded. All in favor of adopting the agenda, please say aye. Aye. All opposed, say nay. Motion carries. First order of business, first item in our order of business is the introduction. I'll start with an opening statement, and then we can move to the invited testimonies from our guests. For the public's awareness and understanding, the medical referral program has a long history in the CNMI, beginning with the Trust Territory government, so prior to Commonwealth status in 1968, and it has undergone significant changes since then under the CNMI government. Its purpose generally has been to provide island residents with the ability to receive health care services that are not available on island. Though there have been multiple attempts to formally establish the medical referral program by law, to include standards for eligibility, patient copay, other parameters for coverage and services, today there is no enabling statute for the program. The program has moved from the Department of Public Health, when it was an executive line department, to the Commonwealth Healthcare Corporation when CHC became an autonomous corporation in 2011 under Public Law 1651. And then in 2013, Governor Eloy Enos issued an executive order transferring the off-island medical referral program out of CHCC to the Office of the Governor, where it remains today. However, responsibility for inter-island referrals has stayed with the CHCC to assist patients traveling from Rhoda and Tinian to Saipan for healthcare. In April of 2020, the administration hosted a community-wide fiscal response summit, during which it was recognized that the medical referral program consistently exceeds legislative appropriations to the tune of millions of dollars every year since at least 2009. Program expenditures and patient volume have remained high despite the expansion of on-island healthcare services in the CNMI, including the establishment of oncology, podiatry, ENT, and orthopedic surgery services, as well as an electronic health record system at the CHCC. Proposals have been made to move the off-island referral program back to CHCC and to establish basic standards by law for the program to ensure equitability, contain costs, provide greater accountability, and improve health outcomes for the people of the Northern Marianas. Our goal as the Health and Welfare Committee in conducting this series of public hearings is to review the Commonwealth Medical Referral Program, including inter-island referrals, to examine how the program can be reformed to enhance services, streamline costs, and improve accountability. For our hearing today, we've invited the Mayor of Rhoda, the Honorable Ephraim Attilig, as well as Ms. Vanessa Kitsigwa, the Director of the Rhoda Health Center, to provide testimonies. We will also be accepting oral and written testimony from any and all interested persons, including our patients, caregivers, healthcare providers, and other community members. If you are submitting oral statements today, we do ask that you limit your testimony to 3 minutes or less. You may provide longer written statements after this hearing by email or submitted after today. Without further ado, let's begin with the testimonies of our invited witnesses. Mr. Mayor Attilig, you may proceed.
Good afternoon, and thank you, Chairwoman Tina Sablan, and the honorable committee members. Welcome to the island of Rhoda. Before you, you have the written testimony, and for the benefit of the committee members and of course the general public, may I please read them out loud. Thank you. Dear Chairwoman Sablan, thank you for the request for comments on the proposal to enhance services provided by the medical referral program, including the inter-island medical referral. The idea to transfer the medical referral program from the Governor's Office to the Commonwealth Health Corporation would lessen the involvement of politicians in the decision-making process as to who and why a patient needs to be referred. The decision would be better made by the medical professionals. I'm sure my fellow politicians would feel better made by the medical professionals. I am sure, but perhaps to transfer this, it effectuates the government would realize less budget deficit because less referral would occur if CHCC would make decisions relating to the referrals. With respect to inter-island medical referrals, Public Law 1978, Section 280E3, or 3E rather, specifies that the CHC shall operate a healthcare program system that includes Commonwealth Health Center, the Rhoda Health Center, the Women's Clinic Center, the Tinian Health Center, and the Children's Clinic and the Community Guidance Center. Nowhere in this public law is it mentioned that if the patient is referred from Tinian or Rhoda to CHCC, the responsibility of the latter ends. All reasonable expenses of referral should be borne by CHC. The municipality of Rota, Tinian, spends a big chunk of their budget in supplementing the inter-island referral by providing ground transportation and associated costs of maintaining vehicles. In addition, the municipalities maintain facilities in the respective mayor's office, which is a major portion of the budget of the mayor's office. It is my construed, or it may be construed, that I am recommending that these services that are provided by the municipalities will be transferred to CHCC lock, stock, and barrel. I feel that patients from Rhoda are my constituents. It behooves me to take care of them to the best of my ability. However, I respectfully request that since the mayor's office provides an essential service, budget appropriation would be made from that perspective notwithstanding provisions in that public law. Therefore, the notion that since the government revenue from RORA is minimal, budget appropriation should be made accordingly. Never mind that it is the obligation of the central government to provide equitable service to all citizens of the CNMI. Many of our inter-island referrals are for dialysis patients being treated on Saipan. Those patients endure hardship because they have to leave their loved ones to undergo dialysis regimen on Saipan. Most of these patients, if not all, prefer to spend the twilight years of their lives on their home island. That being said, I would like to ask the legislature to consider appropriating funds for dialysis equipment and personnel needed to operate a dialysis program on RORA. The structure for this program is already in place. I know that a dialysis program is not cheap, but we cannot place a price tag on the value of having our unfortunate citizens feel that their leaders aren't concerned about their welfare. Madam Chair, I hope that my comments will assist the committee on its deliberation. Thank you.
Thank you very much, Mayor Nathalie. At this time, members, are there any questions for the Mayor? Vice Chair Lewis.
Thank you. Oh, sorry, a little loud. Thank you, Mayor Atalig. I was really curious earlier when you spoke to us at the earlier event, and I wanted to know how many people in Rhoda currently are on dialysis off island.
Currently, we have 11.
Thank you.
Thank you, Vice Chair. Any other questions from the members? Representative Abate.
Thank you, Madam Chair. Thank you, Honorable Mayor, for being here with us again
Thank you.
today and for sharing your testimony on the medical referral program on RODA. At this time, can you explain the process that one would go through in order to apply for the medical referral program, and how does that take place here on RODA? Is it solely through the RODA medical clinic? How does a gap exist where politicians or other leaders get involved with the decision making?
Well, one would, if you need to be referred to Saipan, a doctor will check you, and a doctor refers that to Saipan. And therefore, the Saipan, community of medical doctors decides on referring that patients to Saipan.
And does that request come through your office for approval?
No,
No, it does not.
no, it does not. We're not doctors here.
How does politicians get involved then? Just to your earlier statement, right? If this program were to be transitioned or moved back to CHCC, you stated that it would lessen the involvement of politicians.
Well, I believe that is up in the Saipan. I'm speaking
Oh, I see.
on the governor's decision to send whoever to wherever.
Oh, I see. So it's a different
Yeah,
situation here. in Rota.
that's that. Yeah.
Okay, so clarified. Thank you. And do you have an average stay for a patient when referred to the island of Saipan?
It depends on the doctor's decision. Some patient may just take one day, and of course, the flight ability to come back is very challenging. So the time of a patient staying in Saipan will depend on two things: the flight and the doctor's.
And because the municipality pays for, these expenses, how do you prepare for such expenses when it's all dependent on, the patient's needs?
I believe the CHC pays for it. Yes.
Okay, so I'm sorry, I might have misunderstood when you stated earlier that the municipality takes care of expenses. Is that just for transportation and facilities?
Yeah, that's for the local transportation and the housing.
On the island of Saipan?
On the island of Saipan, correct.
Okay. And at this time, how much of your budget is dedicated for that purpose?
I would say maybe 12%.
Okay, 12% of your total budget for the mayor's office?
Correct.
Okay. Thank you, Mr. Mayor.
You're welcome. Thank you.
Chairwoman.
Thank you, Representative Vallata. Any other questions for the mayor? I have a couple of questions.
Sure.
Just going to the question about the cost to the municipality. We just discussed this 12% portion of your office budget that goes to maintaining facilities and vehicles and providing transportation on Saipan. But don't you also have staff that you detailed to like the Guam Medical Referral Office? So your office is also providing support even for off-island referral, at least on Guam, is that correct?
That's correct. That's
Okay,
correct.
so how much of that are you providing? Are you doing that in Hawaii as well?
No, not in Hawaii, only in Guam and Saipan.
Okay.
So I have 3 staff supporting the operations in Guam.
Okay, and so how much of that is costing the municipality?
About 5,000.
5,000 a month?
Mm.
Okay. Okay, so this 12% that you mentioned does not include the additional cost for Guam off-island referral?
That's right. That's right. Yeah. Sorry about that. Not clear. Clarifying.
Yeah, no, and it gets confusing, right? Because a lot of people don't realize that inter-island is handled by CHC,
Yes,
off-island.
that's right.
Yeah, okay. I guess that would be it for my questions for now. And I think we can move on to our next
Thank you.
witness.
Thank you.
Thank you, Mr. Mayor, for your testimony. You're welcome to stay with us. There may be other questions that can be
Sure.
related. But yes, at this time, we can now move to
Yes.
Ms. Kitsugo, the Director for the Rhoda Health Center. You have the floor, ma'am.
Good afternoon, and thank you for the invitation and a lot of time to speak and share insights on the medical referral program on the CNMI, most especially on Rhoda. For the record, my name is Vanessa Kiragwa, and I am the Resident Director of Rhoda Health Center, CHCC, and I have been in this capacity for 6 years now. As we all probably know, Rhoda residents have no hospital access on the island. All patients are referred to the Seoul CNMI Hospital through CHCC's Inter-Island Medical Referral. Once in Saipan, the Rhoda Medical Referral, or LACEN office, provides ground transportation and housing accommodation, as what the mayor had mentioned earlier. Due to the high volume of referrals, the Rhoda municipality is greatly challenged financially, most especially with providing housing for all patients and money for their meals. This is also a barrier that Rhoda residents have to live with. Many times, patients don't bother to go to their appointments, even if referred, due to this hardship. Medical referral to and from Saipan is very costly for Rhoda Health Center and the Rhoda municipality. Please allow me to provide the types of patient referrals or transports that are being processed at Rhoda Health Center. There are 3 types. There's off-island, inter-island, and medivacs, which is medical evacuations. Off-island medical referral is when patient referrals are outside of the CNMI, such as Guam, Philippines, or the U.S. mainland. Complex medical cases that cannot be managed in the CNMI may be referred to a facility outside of the CNMI for care. Most of the off-island referrals are to Guam, Philippines, and U.S. mainland, dependent upon the clinical nature of the referral and health insurance coverage of our patients. The burden of chronic diseases, including complications associated with diabetes, cardiovascular disease, and cancer, is evident within the medical referral process. A total of 40 off-island medical referrals were successfully processed in 2020 here in Rhoda. Over 50% were for care related to cardiology, urology, and radiology, due in part to the lack of medical specialists within the CNMI. In all cases, the Rhoda Health Center primary care provider recommends for the patient to be seen by an off-island specialist, and all forms or applications are prepared by the Rhoda Health Center medical referral assistant, which is stationed at the clinic. The referral package is then forwarded to the CNMI medical referral program in Saipan. The referral committee reviews and provides their recommendations or approval, and then the patient is assigned to a caseworker who arranges all appointments and communicates directly with the patient from Saipan to Rhoda. There are some instances where managing patient referrals is challenging when being done off-site, island to island, so the Rhoda Health Center medical referral assistant usually steps in to ensure that the referral is completed, and this is for the off-island medical referral. As for the inter-island medical referral, the patient is referred to Saipan, to CHC, and any other private clinics such as MEI, or the Sleep Center, or Heart Eye Clinic. There are 3 types. I have broken down the 3 types of inter-island referral, which are very common here coming from Rhoda. One is the appointments, the other is the short term, and the last one is the long term. For appointments, compared to residents of Saipan, there are many more barriers to health services, stemming from the lower availability of services, the hardship of travel to and from Saipan, and other factors. Majority of the inter-island referrals are for regular appointments at CHC, where patients meet with specialists or receive specific health service that is not available at Rhoda Health Center. A total of 565 inter-island medical referrals were successfully processed in 2020 for patients. The reasons for patients' inter-island referrals are for ER visits, radiology, CT, echo, mammogram, physical therapy, OBGYN, oncology, surgeries or consultations, orthopedics, ophthalmology, psychiatric, colonoscopy, and renal, which these are services that are not available at the clinic. For the short-term inter-island medical referral, these are for deliveries and chemotherapies. Since 2015, all pregnant females, 36 weeks or sooner, depending on their health conditions, are referred to the Saipan Hospital. Most expectant mothers have to temporarily reside in Saipan for about a month and a half, which is a financial burden to families and the Rhoda municipality. RHC's labor and delivery suite is not fully equipped, and risk of delivering a baby in Rhoda is greater compared to Saipan should an emergency arise. RHC does not have a blood bank or an intensive care unit. And the last inter-island referral would be the long-term, such as those patients who are on dialysis and other long-term treatments. 11 dialysis patients, like what the mayor had mentioned, are currently residing in Saipan because the treatment service is not available on Rhoda. The other type of referral is the medical evacuations. These are emergency and life-saving patient transports to CHC or Guam after exhausting all the resources in the CNMI. These are for the Guam Medvac. Medical evacuations to Saipan usually cost more when a plane needs to be chartered to transport the patient to the CHCC's hospital. The medical provider at RHC determines the need to send the patient to a hospital due to the facility's inadequacies and/or patients' critical health issues. During medical evacuations, the patient, a flight nurse or physician, and a family escort will be transported to Saipan. If a charter is not available, the U.S. Coast Guard on Guam will be requested via CNMI Homeland Security and Emergency Management Office. Our 2020 data has shown that for inter-island medical referral patients, there were 565 patients that were sent. For the medical medevac and medical evacuations, 38 patients. Family escorts, 167. Medical escorts, 8, which is a total of 778 people that were sent in 2020. For the off-island referral, which is a lower number, patients are at 40, family escorts 31, medical escorts 1, which is a total of 72. The realities and hardships of our medical referral program is a result of little to no funding. All patient transports are necessary due to healthcare service limitations on the island. Patients, RHC, and the Rhoda municipality are all financially challenged to keep the program running. How do we overcome these challenges? After analyzing data from 2020's inter-island medical referral and with the guidance of Dr. Conan and approval of Dr. Tudela and CEO Munya, RHC has implemented a 2021 specialist outreach clinic schedule where specialists from CHC are scheduled to be at Rhoda Health Center to see patients. The specialists and dates were outlined and advertised within our community. Through this way, specialists are available on island and it helps decrease inter-island medical referral costs. CHCC also has policies in place for inter-island medical referral, which is 3159 for non-emergency intra-CNMI medical referral, which was revised in 2021, and 3158, which is the inter-island emergency medical evacuation, which is revised in 2018. The recent revision of 3159, which is the non-emergency, includes an upgraded management and monitoring system to account for all patient referrals, collection of co-payments for airfare and hotel from patients, which have not started yet due to the pandemic, and accountability guidance and measures to prevent any sort of program abuse by patients and better tracking system by the inter-island medical referral staff. The CHCC's travel office pays for the airfare and hotel of patients referred from Rhoda, and the respective mayor's office pays for the long-term housing and subsistence expenses for the patient and escort. The patient is responsible for the medical expense for the referral. Meal stipends are provided when funding is available. As for the dialysis, there is some planning underway for a proposal to expand peritoneal dialysis opportunities to Rhoda, which is lower burden cost-wise, and the provider is subject to different standards. Since hemo still seems to be a non-starter due to cost and operational barriers. Some of the recommendations: to provide funding to RHCCC to support the inter-island medical referral program and specialist outreach clinics, and the Rhoda Medical Referral Liaison Office. Housing for long-term referral patients need to be assessed and upgraded to accommodate present needs. Recent regular charters to Saipan are as a result of the limited SMA seats or flights to Saipan. We only have 3 flights per day, and at times when we have to send a patient, there are no seats available, so we end up having to charter the flights. So would it be possible to work with SMA to set a patient transfer charter fee rather than the full rate fee of a charter at, I think, $1,000? Invest in improving healthcare services on Rhoda or in the CNMI to reduce medical referral costs, such as access to telehealth, which is what we have been exploring, such as teledentistry, telepsych, and telepharmacy. I hope that you're able to gain important information from invitation and consider the need to financially support the core expenses of the medical referral programs. Once again, thank you for the opportunity. Thank you.
Thank you very much, Director Kitsugo. Are there questions at this time for the Director or for the Mayor? Representative Miller.
Thank you, Chair. Thank you, Artie. Thank you. The question is more on the 565 in Iran. You have the breakdown as to what types of I guess, referrals, what types of illnesses are the make up this 565, and is that how you're going to determine which specialists to bring down, or?
We do have the breakdown, and actually with the ones that I presented, of the top highest are for ER, radiology, CT, echo, mammogram. So I just pulled out the top referrals, but in total, it comes in variety. So in total, it's a 565. But I don't have the numbers right now, but I can provide that to you.
The reason I ask is because even, I mean, I don't think did you mention physical therapy?
Yes.
Something like that, where it takes a long time, sometimes they're there for 6 months.
Yes.
That's 6 months of hotel versus sending somebody down.
Yes.
The next question I had, and that doesn't, I think it really deals with medical referral, but it deals with access to medical care. And I bring this up because it was just brought up as a request asked during this public hearing, and that pertains to medication. I've been getting recent inquiries about having to wait for an order rather than the clinic here carrying sufficient, I guess, an excess supply so that patients can get their refill right away rather than having to wait. Is that something that changed?
There's a recent change in pharmacy. So I believe it was about two years ago that we have added outpatient pharmacy to Rhoda Health Center. So we used to only have inpatient pharmacy, which that is only for prescription that is provided during the clinic visit. But now you can get your full medication or refills under the outpatient pharmacy. So as part of the outpatient pharmacy process, they would have to request from their provider, and then that request would get sent to Saipan through telepharmacy. And then medication, if we don't have them on stock, then they would have to send them from Saipan, and it's scheduled on Tuesdays and Thursdays to arrive on Rhoda. So part of the I guess maybe that we've been doing with our patients is to educate and to inform, to come into the clinic in advance so that they can request for their refills in advance, so that it's not something that is last minute and the shipment of the medication is on a different day, or Tuesday or Thursday. So that's a result of the outpatient pharmacy addition to the Rhoda Health Center's services.
Great, thank you for that. One other question I had was off the 565, the order for Interand. Do you know what that cost came out?
Yes, I was supposed to put that together, but I don't have enough time to give you the report. I would have to ask that from our CFO. I can get that for you.
Thank you. Thank you, Chair.
Thank you, Representative Williams. I think Representative Atta, you have a question?
Thank you, Chair. Thank you, Ms. Kitsugo and Mayor. Thank you for joining us this afternoon. In line with the medication Do you have a dedicated staff that handles the medications, and how many patients here on the island is in need of certain medications, so that it's an easier transaction between CHCC's outpatient pharmacy into Roda's outpatient pharmacy?
So we have a pharmacy intern and a pharmacy assistant on the floor during outpatient clinic hours. With the process, the pharmacy intern would have to go live with our pharmacist at the outpatient pharmacy before dispensing. So that's also part of the implementation of telepharmacy with the outpatient pharmacy medication dispensing. So we have two on site, and then we also have telepharmacy pharmacists online.
Okay. And so with that, usually medication is prescribed for a month, right? A month's worth of medication. And logically speaking, if the patient is taking the same type of medication that's before high blood pressure or diabetes, we already know that they're going to be receiving a monthly dose of that medication. I know as being the patient, sometimes you forget, the family members forget about their medication. And you mentioned that medication is brought out every Tuesday and Thursday, and there's certain types of sicknesses that are dependent on the medication, and missing a day might be detrimental to that individual. So if there's a dedicated staff that actually monitors the monthly prescription of patients here on Rhode Island. Let me say that because it's a smaller population, right? And but it's also not fair to dedicate this much time for that specific issue. But if we're dependent on getting medicine here, and it's only on those 2 days, imagine if the person ran out of medication on a Thursday, we have to wait for the following Tuesday, and missing medication for heart and for diabetes, that can be very detrimental, and that could be associated to more costs than that could have. And the mayor's subsistence of housing and transportation and allowances. So maybe that's something to consider, or maybe that's something we should bring up to CHCC themselves, the main office, so that there's a dedication from their end also to make sure that the prescription medication gets to Rhoda 2 days, 3 days, or 5 days before the end of the prescription, or closing of the prescription, provided that nobody passes away during that process. So also with that, maybe on the medical referral portion, what's the average cost? I know that health is very difficult to determine the cost, because a good year, 500, and a bad year, you can have 1,500. So associated with the cost of medical referrals is difficult. It's always a moving target. But with this pandemic, it also allows us to calculate how much we've saved without sending people beyond, I guess, sideline, right? Because of the closure of a lot of the borders, so they're receiving entities like the Philippines or points to the U.S. mainland and in Hawaii long. So maybe that's something we can at least calculate for now and base that for the future. We're always going to need medical programs. Let's not kid ourselves. We don't have the population in the CNMI to have specific professionals dedicated to certain types of services. We just don't have the population. So we're still going to rely to offer that medical program. So that maybe we can use these numbers of 20 to determine how we can better ourselves financially and save us from medical program. Thank you. Thank you, Jim.
Congressman, that's correct. Thank you for that. And that's really why I mentioned during the Ways and Means Committee meeting that we plan to bring back our patients to we have the facility here now. All we have to do is hire a doctor, a nurse, and what have you. And the question that the chairman William was asking me about the cost, I will provide that next week. So like I said, there's no, a patient is better, they feel better at home. So I guess this is an opportunity under the ARP to look into that possibility. Because there's no place like home.
Absolutely agree. Sorry, you mentioned the dialysis center. Has the Cameron community health center reached out to CHCC Road?
Hangman?
It's an outreach program that used to be associated with CHCC. It was through a grant that allowed them to open some sort of a pharmacy and a clinic in Tagway. But this clinic is more equipped than, I believe, the Rhoda Health Center and the Tinian Health Center. And this is all through a grant that they're running. Well, what I know is they've reached out to Tinian, and they were talking about reaching out to Rhoda. That's why I asked if they've reached out to you, Mr. Mayor, and maybe Director, if those were ever presented to you guys. And maybe that's something we can do.
Is this pertaining to the federally qualified health center?
Yes.
I did join Vince at one time in applying. The second attempt that I tried to submit an application for Rhoda Health Center, we did not get the grant, and this is for the new access point. It's, I think, only offered every 2 years, or whenever funding is available. We are now, as CHCC, applying for the lookalike under the FQHC, and that application will be submitted for Rhoda Health Center, Tinian Health Center, and FCC.
Okay. Thank you. Thank you. On the CDBGDR, the CHCC or the administration of the municipality of Rhoda request for funding for CHCC Rhoda, maybe a mobile clinic. Is that ever presented to CDBG or
That was included in CHCC's request for a mobile clinic for Rhoda. We do have one on the island, but that was more of like a loaner that was given to us from Saipan and transferred to Rhoda. But I know it was included as part of the CDBG application that was submitted from CHCC for a mobile clinic.
Well, that's good news. At least we know that CHCC is looking out for Rhoda outside of just the main office and outside that. Thank you, Jim. Thank you, Thank you, Mayor.
Mr. Vice Chair, any other questions from the members?
Thank you, Madam Chair, and thank you, Director Kiswa, for your testimony and really providing a very comprehensive just outlook on the healthcare situation here on Rhoda that many of us are not aware of and still learning about. So that is very much appreciated. You did mention all the patients who have to travel off island or inner island for services. Just giving us an idea of what type of services are not available here at the Rhoda Health Center. So what services are available?
So Rhoda Health Center actually now has an outpatient clinic, so it's more of a primary care clinic where they see their providers. We do have a ClearWave lab. We have an outpatient pharmacy, an inpatient pharmacy. We also have radiology with X-ray and ultrasound services. And we do have the inter-island medical referral. We have an ER area for stabilizing, for trauma, and for making sure that we are stabilizing patients before we send them out for critical care in Saipan or Guam. So other than the ER, our main priority at the outpatient clinic is primary care and making sure that our patients are followed up with their health regularly, rather than, and not encouraging urgent care or ER situations.
Thank you. How about I eye care and dental?
Ophthalmology we don't have, dental we do. And for dental, we only have the dentists come over with their team for 3 days every month. Aside from that, we also do school sealant programs, fluoride varnish for our children, and they also do outreach to Head Start students. The only thing is that we only have 2 dentists in the CNMI, which they have to take turns coming into Rhoda and Tinian. So they are scheduled to be here 3 days every month.
Wow, thank you very much. It seems like because of the available resources or lack thereof, outreach and public education on prevention and healthcare is paramount. Is that something that you work on or collaborate with other offices on?
Local offices or within CHCC?
Both.
Both. Okay, so most of the services such as public health, now MICA, and family planning and other programs are part of Rhoda Health Center services, which are supposed to be embedded into the primary care plans or treatments by the primary care providers. So those services are available in the clinic. We also do some outreach when available, but since COVID, we were mainly focused on getting vaccinations throughout the island, and also any swabbing testing that we can already do at the clinic. So outreach so far has been more of the COVID missions or operations that we've been doing.
I see. Thank you very much. This morning, Rep. Staffler and I, we got the opportunity to visit the Omelet Farm, and Mayor, we'd just like to really recognize you, your staff, the Women's Affairs Office for, my goodness, all of their efforts in revitalizing that area that really has so much history and cultural knowledge that we saw them passing on to our youth. So while we were there, students came out to visit the farm and learn about our local medicine, right? Plants that we can use to really heal ourselves. So what is the Rhoda Health Center's, I guess, thoughts around that type of holistic healing or alternative healing? Is that something that you support?
Personally, yes. I have not fully introduced the project with Southern Almond to our staff yet. It's fairly new. I was not there for the opening, but we will eventually get into that. And as a local, I do believe, and it's part of our culture, to embed that as part of our lifestyle on the island. So that is important, and we will eventually get there with our staff.
Thank you. My last question is in regards to the structure that Rhoda Health Center has with our CHCC on Saipan, or the headquarters. How often, can you just describe the relationship? How often do you communicate your needs to the MCPO, Esther Munya? How are they just made aware and updated on the needs of Rhoda, the community, and your facilities?
Rhoda Health Center under CHCC is, we communicate daily. I mean, all requests of communication, transactions are CHCC bound. The clinic is overseen by our Deputy Medical Chief, Dr. Bonin, as well as Dr. Tudela. Providers are also in tune with what's going on in Saipan. Services, programs are available on our expanded to Rhoda Health Center, and I communicate on a daily basis with the CEO and any other leadership in Saipan.
Thank Thank you. That's very reassuring to hear, as we know that our great staff at CHCC, and the leadership team they're so supportive of an overall improvement of the healthcare system in the CNMI. And so I think part of our goal here, just being on Rhoda and making our way to our neighboring islands of Tinian, right, is to really promote interconnectedness amongst the islands and ensure that we are properly supported and we properly communicate our needs and resources to bring us all forward together. So thank you for making time to be with us today. Thank you, Madam Chair.
Thank you, Representative Kubota. And any other questions from the members for our witnesses? I do have a few more questions. Vice Chair or Vice Speaker Atal was earlier asking about the COVID numbers, or the data from 2020 that you provided. And I was wondering, what do the referral numbers look like pre-COVID? Can you give us a picture of that? And then are you seeing any changes with the introduction of these visiting specialists now that they're coming on a more regular basis? Are you seeing any impact on the referral numbers at this point?
Pre-COVID, I believe we had more numbers of referrals, and at that time, sometimes it's harder to manage and document because we haven't been really looking into the data. So 2019, 2020 is when we first started to look at really and track. So it has been consistently in the 500s. I know 2018, I believe, was 570. And then 2020 came up to 565, 556. And then now with the specialists coming almost every week or every other week as scheduled, that has decreased our referrals. So that has been doing really well so far.
And that just started this year?
This year. And we have Dr. Shet, podiatry, we have Dr. Brett coming in for oncology, ENT, and we also have PT that's soon to come, and we just had Dr. Austin also this week. So we've been getting fair share of specialists coming over and seeing an average of 10 to 15 patients at their visits.
Okay, that's remarkable. I saw the poster outside actually with the schedule of visiting specialists. And then similarly for telehealth. So you mentioned telepharmacy is being provided at this time. Are there other telehealth services that are available? And are you seeing an impact on referrals in the inter-island or off-island?
The most that I've seen so far is Telepsych. So that we have been able to explore and try it on with some of our patients. For Telepsych, some of our patients don't have to come to the clinic. They can actually be at the comfort of their homes, and they can communicate and see their providers over their phones, which is very convenient for most patients. We do some telehealth, which is specialists on the Zoom platform, or I think it was Doxy.me or some platform that we have been using, and that also works for our providers for telehealth with specialists in Sacramento.
Yeah, if you could provide that pre-COVID data, and then any other insights you can share about how the expansion of on-island services, whether through telehealth or through these visiting specialists, what impact that has had on those lives. And then just to clarify, so CHCC, other than the cost that the mayor mentioned for facilities and ground transportation, CHCC absorbs the rest of the cost for inter-island referrals and medevac. Is that correct?
Airline and hotel now, and medevac charters.
And could you give us a picture of what the health insurance coverage looks like on Rhoda? Because for some insurance providers and Medicaid particularly will cover these off-island referrals, right? Or as well as inter-island referrals. So what does coverage look like here, and how much of these other costs are being absorbed by either CHCC or the municipality?
For now, we're seeing more of the pandemic, which is the presumptive eligibility more common, and they're taking advantage of the healthcare services that are available. We also see high numbers in Medicaid and Aetna insurance.
And even before presumptive eligibility for the pandemic, so there's a pretty high rate of
Medicaid and Aetna.
as well.
Yes.
Okay. And then going to the mayor's concerns about the dialysis patients on Saipan, you mentioned these kind of long-term plans. It sounds like for peritoneal dialysis, which would make it possible, right, for home dialysis. And Vice Chair Staffler and I just signed a letter of support for a number of CHCC's proposals for infrastructure funding, federal infrastructure funding, including peritoneal dialysis. And I was wondering if you could just speak a little bit more about that. And, you know, is there any kind of timeline that CHCC is looking at? How soon could this be a service available to Rota residents so that they don't have to live on Saipan for dialysis?
I don't have the full information on that. All I know is it was out as a survey to the community, and then it was also a plan that was being offered to Rota and Tinian. So I don't have the full report on that or information.
A little early, right?
Yes.
The submission was just made last
Yes.
week, so, okay. And then I was really surprised to hear that all pregnant women have to go to Saipan for a month. And so no deliveries are done here in Rota. How long has that been the case?
Since 2015.
Okay. Prior to 2015, there was an ICU unit or an ICU and a blood bank, or it was
No.
just risky deliveries happening?
Deliveries were happening, and then there was I guess maybe providers' realization at that time in 2015, and they just did not want to have the babies born here due to no blood bank, or if anything happens, then we don't have the capacity at the facility. So it is a risk, and we don't want to take that risk.
But yeah, I think your point earlier about the burden this is for the women and their families.
Yes.
Have to, go to Saipan for that extended period. That's a lot. Okay, and then I guess my last question is really for the mayor. So Director Kittigwa went through a number of recommendations about how we could reform the medical referral program, both inter-island and off-island. And you mentioned a few ideas, particularly your concerns about dialysis, bringing people back here, and then appropriating more funding to assist municipalities with these costs. But I was wondering if you also might have other ideas about how we can reform this program and streamline these costs and also improve services and on-island care as well for the people of Rota. If you want to just elaborate on that a little more, and I think that would be helpful.
Well, the idea of bringing dialysis here is very new. Well, actually, it's not new. We've discussed it sometimes, but to seriously discuss it, I think it's time for us to sit down and talk about it. Since we are seeing potential funding on the horizon, such as the ARP. So we would figure those out once we actually, when I say we, the leadership, and I hope one day soon we'll get together. You know, the people of Rota are suffering, and that's why it's very critical that we really sit down and discuss the issue. But like I said, this is law, and I hope that we can discuss this anytime very soon.
Thank you for that. And Director Kittigwa, did you have any closing statements?
No, thank you.
And with that, thank you to both of our invited witnesses, Mayor Atterley, Director Kittigwa. You're welcome to stay and listen to any public comments, but We do appreciate your presence, and thank you, Mr. Mayor, for coming back twice today.
Thank you to all of you, and welcome to Rhoda. Thank you very much.
Okay. And at this time in our agenda, we now will open the floor to public comments. This is for anyone who wishes to make oral or written statements. Now's the time. We do ask that you limit oral comments to 3 minutes or less.
Just a moment. Give it to Cam.
You could please state your name for the record.
Good afternoon and welcome to Rhoda. My name is Vanya Nasri. I heard Mr. Nessa mention about the new policy on medical referral, and she said that policy is already approved, but because of the pandemic, that they put on hold. So I would like to ask this body, are you aware of that new policy that CSC has in place? Because I believe to be reformed. But however, that if that policy would affect more on the referral patient and their family, then I ask this body to look at it and consider maybe giving more money to medical referral, so that will lessen the hardship, the anxiety, the stress of the patient and their family. Thank you.
Thank you very much, Ms. Castillo. The floor is now open.
Good afternoon. My name is Rosita A. Oko, and I thank you for coming to help us improve the medical referral program. What I'm aware right now is that it's not a perfect program, and even if we were to add some improvement, it is going to be an ongoing work. One of the things that I recommend, because as it is now, the way it's formed, there is a guideline with respect to income bracket. Who qualifies for a full medical referral and who doesn't qualify. One big example of that, I have an experience of a family member, is that because exceeding the income bracket by a few dollars, he's only entitled to one-way ticket referral to Guam, but he is on his own to come back home. So I think that the government should look at that, because I think we don't want to be stuck in Guam or even Philippines if that's the case. I would ask that part of the income bracket be thoroughly be reviewed. And with the new policy that is being in place but not effective, I think it's even going to be worse, because the minute you fly, you have to sign something, and then you are willing to pay so much and so much. And if you don't have the money, you might not get treated, or you will wait until you have the money. So we all need to survive. The government needs to survive, and the people more so needs to survive. So I ask for your kindness to really review what is in place before and now and make the recommendation. But also I like to incorporate that we have 2 physician assistants here, if not mistaken, and MD. She's nodding, Vanessa's nodding yes. There's a certain policy with medical referral for off-island that they only meet once a week. And if you miss the boat, you got sick on a Thursday, and they already met on a Wednesday, then you have to wait until the following Wednesday to be reviewed whether you can go to Guam or elsewhere. I find it beyond my comprehension when we have the professionals here to determine whether that patient needs to fly to Guam directly and not go Saipan around and then down to Guam. Especially knowing that they don't have the specialists in Saipan like a urologist or a cardiologist for that matter, that they need to read your imaging or whatever. So that I find it disturbing for only the medical referral committee to approve whether you can go or not. Can Rhoda Health Center doctors, in consultation with the doctors in Saipan, through teleconference or whatever, with all technology available, to approve and send directly to Guam, and not be paying more going to Saipan than going to Guam or elsewhere. Thank you so much.
Thank you for your testimony, Ms. Wilson. At this time, I'd like to recognize Senator Paul Magnolia. Thank you for joining us, Senator. Are there any other comments from members of the public? The floor is now open.
Thank you very much to all of you for coming down to Rhoda. We really appreciate it. Normally, I can go look up all of you guys in the offices and talk to you, but I think I need to bring this up in this forum. People are listening, and I want them to know a little bit of the situation here. I just want to say that if you look at Public Law 15-61, that's the law creating CHCC, it is very clear that Inter-Island Medical Referral falls under CHCC. And I keep telling committees after committees over the years about that because they seem to not understand that. But if you look at the purpose of CHC, it says there specifically that, just give me a second, I can read, quote the law, part of the law. It says, there is hereby established in the Commonwealth a Commonwealth Healthcare Corporation. And then on section B it says, the corporation shall assume the function and duties of 1, 2, 3, and number 4, it says Inter-Island Medical Referral Services. So it appears that CHCC interprets Inter-Island Medical Referral Services to mean only airfare from Rota to Saipan. Okay, so I just want the committee to appreciate that our legal counsel is here, right? So you asked the question to Imelda and the mayor, what are the what's the local government incurring, right? Let me say that Inter-Island Medical Referral Services should include stipend, right? I mean, if you send somebody from Saipan to Guam or to the mainland or to the Philippines, of course you give the patient stipend, and when we have more money, we also include the escort. But from Rota to Saipan, they don't give now presently, and when they do, it's coming from local funding from the casino, right? And we all know the story about the casino license fee. So it doesn't look good in the future for our patients here on Inter-Island Medical Referral, because CHCC doesn't give them, or the medical referral doesn't give them stipend, only if they go to Guam, because Guam is not considered Inter-Island Scope of Island Medical Referral. And that's why Ms. Zuzu here is correct. If you take 1 week to decide the medical referral, they'll probably send you to Saipan if you pressure them, because the doctor here probably will send you to Saipan tomorrow, but when in fact you probably need to go to Guam, right? Go directly to Guam than to go to Saipan and then Guam, and that could be the effect of not having a prompt decision, right? But let me go back to the question of expenditure. So the delegation from this local money from the casino license fee, we give, it's not CHCC that pays for that. They stand to be corrected. It's the delegation. We give money to CHCC for the hotels, right? So then they put them in the hotel. Maybe the airfare, they do cover that, but at times we supplement the airfare from local appropriation. And so I just want to point that out, the public law and the expenditures that we are incurring here. And inter-island medical referral, by the way, should include dialysis patients because we don't have the dialysis units here. And so we have to send them off island. They would much rather stay here with their families and attend to their farms, in the evening, right? So they have to be displaced. As far as expenditure, again, let me say that the operation, the ground operation, transportation, and the medical referral guest houses, we have two, one in Financiso and one just above the hospital there. Those are all under local appropriation. Sometimes they're in the budget under the personnel district. Many times we supplement that through, throughout the year. That's again from local money that we could use for other programs. And on top of all of this, we also give medical subsistence, not the stipend, medical subsistence. We're working on the board on how to do that so that the delegation can be taken out of that on approving who is qualified for this, but we're going to be passing a law to give a board or something so that politics stay out of that. So I just want to point that out. The other thing, as far as expenditure, do you know that if you're from Rhoda and you go down to the hospital and you get your blood work, I don't know if you know, but they charge you just like a resident from Saipan, but then they say pay an additional fees because we need to send on Star Marianas the blood work. So what did the delegation do? They put in 50,000 maybe to cover that, but if we don't appropriate, then the following year the people here would have to be charged just like you guys, but another $15, $20 because they have to ship it up to Saipan, right, at the laboratory to be tested. And then I just found out this out 2 weeks ago. If you go to the hospital and you pick up your medication, they charge you just like us. They charge you the same amount. But then they tell me, oh, but you have to pay another $10 or $15 because, the shipping cost. They have to ship it from Saipan. I think that's wrong, and I think we're going to try to, in the next appropriation, put some money for that. But again, this is something that we need to, the committee really needs to look at that. The other thing, if inter-island, right, if you go up to CACC, you just go by yourself, right? You don't need an escort. You just go up to your hospital. Us, if we have to seek treatment for something we don't have here, we have to bring an escort with us. And that escort have to apply for a leave, sometimes 1 week. Those are costs that you don't normally think it's there, but if I have to bring my wife or my brother, right, or my sister, they have to take a leave of absence and they don't get paid. They have to apply for a leave. I just want to point that out. And you asked the question to the mayor about the dialysis facility. That dialysis has been in the planning since 2003. We put up more than $1.5 million, and then almost another $1 million 4 or 5 years later, and then even after that, imagine, Public Works gave it to professional engineers and architects to do the design, and then lo and behold, nephrologists come to tell us that, there are these mistakes, this thing, this and this, and Public Works doesn't want to go and check those engineers and make them accountable for their design. But okay, so we're moving on. But there's more than $2 million facility. If you have the time, go there. It's on the right side as you look down to the hospital. It's done. But okay, we might need to do maybe another $500,000 maybe to fix it. We can do that. We told them we can do that because it's just CIP money, right? But I think the issue here for all of you, it's not the building, it's not the equipment. We can get that. They can get that tomorrow if they want. There's no will. If there's a will, there's a way. But you know why they don't, I think, for me, you know why I don't think that they want to do it? Why do it? You already have the customers, right? You already have 11 customers going to Saipan, right? And they're paying federal, Medicare, right? They're already paying the CCC, so why pay for a nephrologist and dietitian and the whole works, right? To have it here. But see, they don't realize that we have also patients other than the 11. They're in the US, they're in Guam, and they're not being counted because they're in Guam or in the US, right? So maybe those are not being counted. But more important also is, if we want to promote Rhoda, we need to say that if you are a dialysis patient and you're from Guam or from Japan or Korea, you can come to Rhoda and you can get your dialysis here, right? So that also benefits the tourists and the visitors that we have here, and most especially the families that have to be displaced to Saipan. So again, we spend more than $2 million. We can fix it up if they really want to put more people, if they want to hire two dietitian and you know, the nephrologist, that's the most expensive one, but as what somebody mentioned, telemedicine, right? You probably just have to put the nephrologist on Saipan and talk to the doctor here, train the doctor a little bit, and you don't have to hire another nephrologist. In Guam, every other village have a community dialysis center, right? And so with this federal money here and President Biden trying to provide more infrastructure money, I think now there's no excuse. But again, I repeat, it's not the amount of money for the building that's stopping CCC. It's they don't want to hire additional personnel, I think, and added cost. So that's something that the committee, I think, can help, and I think we can make it possible. Going to the big issue of the medical referral, I have always mentioned that the biggest problem as far as the budget process for us, the lawmakers, is, you know, every year we pass a supposedly balanced budget, but we know that the medical referral expense is 20 million more and all that, but we just say it's balanced, and then later on we know that we have an overrun. That's something that we have to tackle and admit that it's 20 million, if it's 20 million, and then go from there. And I hope that this new leadership would seriously consider that. And that's a challenge. It's hard because you know, you have to balance it, but nonetheless, we know that year after year the amount is 20 million, and I'm glad that you are looking into that, Madam Chair, and the members, as to how we can cut costs and how we can run a more efficient medical referral program, and the whole works, how we can stop the abuses. That's a challenge for all of us, and I hope we can work together with the Senate. I have to say that I'm a minority in the Senate. I am not a member of not even one committee, and so I hope that sometimes when you have public hearings, you don't get tired of seeing me, because I really want to put in my 2 cents worth in trying to address the financial crisis we have in the CNMI. And as far as your House Bill 22-33, I think it's in the Senate. That's a very good bill. I think that we're going to ask for its placement in our calendar in the next session. I know the questions before us is, how can the Speaker have 2 votes? The Speaker don't have 2 votes, by the way. The Speaker have only 1 vote. The other vote is you 20 saying, Mr. Speaker, there's a tie, take my vote. Take any one of our 20 votes and you decide. I think that's the real argument. And so it's not the Speaker having 2 votes. So we're going to push for the passage of that bill. And as you can see, there's so much money that we can address, for example, to dialysis, to medical referral, to hospital equipment. And that's where we do need to come in, because there's no local money, right? So that's where the legislature say federal money should be put in A, B, C, D. Sidu Smasi, thank you for your time.
Thank you, Senator. Thank you so much. Senator, if you have written statement that you can submit, please
So you can send that by email if you have a written statement. And actually that goes for our earlier commenters. If you have a written statement, please feel free to submit that to the committee. Are there any other members of the community who wish to give public comments? Please state your name for the record, and please try to limit your comments to 3 minutes or less.
Thank you, Madam Chair. Welcome to Lucha, distinguished members of this committee. This is one of the most, very important section in the legislature. It deals with the health and the safety of the people. That's our lives. That's human nature. I would like to echo what the Mayor Anthony was saying earlier, the importance about the dialysis center. I'm sorry, my name is Ignacio Sotomayor. Sorry about that. Yeah. So anyway, also I'd like to echo our good Senator Paul here, Chairman of the Royal Delegation, echoing the need for the dialysis center. And he's right. The center's been sitting there collecting dust literally. And the thing about this is, I would highly recommend, because it's our moral obligation. It's a family thing. Okay? We're all human beings. So those people, those 11 people, residents of Rhoda, that have to live inside them just to, be treated at CHCC. I think what we need to do, Madam Chair, and I highly recommend that we encourage CHCC put together a task force, a committee, to really find out what is the problem, what was the problem, why the Rota Dialysis Center is a sitting duck, why it's not operational. So I suggest that the medical experts in this specialist unit should be put together just to find out answers to this question. Why and what does it take to make it operational? Because I understand it's a very specialized unit and it takes specialized people, experts, the center itself, the facility is very delicate. So we can finance the center. We can identify money, even the ARP. We have about $500 million that we can tap into thanks to Uncle Sam. But it's not forever. Okay? It's budgeted, federal money budgeted for us to utilize at a certain period of time. At a certain time, it's going to be exhausted. But what the Mayor was saying, and what a good senator here, even our Rota delegation chairman of the Ways and Means, we all feel for our people. So again, I don't want to continue repeating myself as I'm living here, but I put together a unit, a task force, to dedicate them to find out and how to make it work, how to revamp it, and have this facility work for the people of Rhoda, so that the medical health of these 11 dialysis people can be accommodated. So we can talk for days, we can plan for days, we all have this concern, we're all human beings. We're more than willing to give our moral support, but let's do that homework first. So I highly recommend that a committee be put together with the experts, find out, make that analysis. Would it be possible? Could it be operational for Rhoda? Thank you.
Thank you, Mr. Murguia. And the floor is now open for anyone else who wishes to make comments. Okay, I think there are none. So we can move now, with no objections, members, to our next item on the agenda, which is announcements. So for members of the public who wish to submit written comments after today's hearing, you may email my office at rep.sablanc@cnmileg.net or call 664-8829 for more information. Our next public hearing on the medical referral program will be on Tinian on May 10th at the courthouse, followed by May 21st on Saipan at the House Chamber. Both will also begin at 3:30 p.m. Are there any other announcements from the members? I know there's a town hall coming up at 6 o'clock with Senator Maglonia and Chairman Maglonia. So that is happening right here in this conference hall. And then tomorrow, budget hearings continue at 10 o'clock here as well. And then the natural resources hearing at 4 o'clock. So that's it for my announcements. Are there any others from the members? Okay. So at this time, may I have a motion to adjourn this public hearing?
Motion to adjourn.
Motion has been made and seconded. All in favor of adjourning this public hearing on medical referral, please say aye.
Aye.
All opposed, say nay. This meeting is now adjourned.